next presenter, Dr. Vijay Kumar MAURYA.
Good afternoon, everyone. My topic is role of topical dorzolamide in the management of increased central macular thickness in patients of chronic central serous chorioretinopathy. Chronic central serous chorioretinopathy is a retinal disorder characterized by the accumulation of fluid beneath the retina, leading to an increase in central macular thickness. This condition often results in visual impairment, which is more commonly observed in individuals aged 20 to 50 years. The pathogenesis of CSCR involve the dysfunction of retinal pigment epithelium and the choroid, leading to the leakage of fluid from the choroidal vessel into the subretinal space. While the acute CSR may resolve spontaneously, chronic or recurrent cases can lead to persistent macular edema, which is a major cause of visual deterioration. Current treatment option for CSCR is limited, with focal laser therapy, anti-vascular endothelial growth factor injections, and photodynamic therapy being some of the modalities. However, these treatments do not always lead to satisfactory outcome, especially in chronic cases where macular thickening persists. In this context, the role of topical therapies, particularly dorzolamide, has gathered interest. Dorzolamide is a carbonic anhydrase inhibitor. It is widely used in the treatment of ocular conditions such as glaucoma and ocular hypertension. It works by reducing the production of aqueous, thereby decreasing intraocular pressure. Recent studies suggest that dorzolamide may also have an effect on macular edema by altering the balance of fluid in the retina. The aim of this research is to know the potential role of topical dorzolamide in the management of increased central macular thickness in patients of chronic CSR. By examining its efficacy, reducing macular edema, and improving visual acuity, this study seeks to contribute to the understanding of alternative therapies strategies for CSR and to provide evidence for the use of topical dorzolamide, a potential treatment option. The aim of the study was to check the therapeutic effect of topical dorzolamide in patients of chronic CSR, and the primary objective was is to decrease central macular thickness and to evaluate safety and efficacy of topical dorzolamide in patients of persistent macular edema. And this was a prospective controlled interventional study at Tertiary Care Hospital, RIU Prayagraj, after taking ethical approval and consent from the patients. Inclusion were the patients who were diagnosed with chronic CSR, persistence of subretinal fluid for more than 6 months by using OCT and the fundus fluorescein angiography. Exclusion criteria were previous history of intraocular injection like anti-VEGF injection, focal laser therapy, and photodynamic therapy. And the CSR associated with other ocular conditions like diabetic macular edema, ARMD, choroidal neovascularization, tumor, retinal vascular occlusion, retinitis pigmentosa. And patients with severe systemic disease like malignant hypertension, end-stage renal disease, pregnancy, and weight loss are also excluded. And patients with follow-up less than 1 month was also excluded. And the patient not responding to topical dorzolamide at the end of 1 month with less than 10% reduction in CMT were also excluded. The mode of intervention, the controls were observed with topical carboxymethyl cellulose 3 times a day, monthly, with base corrected visual acuity, subretinal fluid, fundus fluorescein angiography, and central macular thickness on OCT. Whereas confirmed cases were treated with topical dorzolamide 2%, 3 times a day for 3 months and followed with the same as controls. The patients were followed monthly for 3 months for the improvement and further followed for 9 months. And the results were checked after 3 months. In demography, maximums were males, and the maximum patients were in the age group of 31 to 35 years, and most cases were the unilateral. And in cases at the end of 3 months, we observed an average reduction of minus 236 micron of central macular thickness, while in controls, we observed at the end of 3 months, the average reduction was 39. In cases, the patient improved at 76%, while there was no improvement in 3 patients, and in controls, the improvement observed in 23% of the patients, while 10 were not responded to the treatment. And the ocular side effects observed were very least, only burning sensation in 1 patient and redness in 1 patient. Discussion: the patient who received topical dorzolamide 2% had greater reduction in central macular thickness as compared to the patient which were only observed at the end of 3 months. A higher proportion of patients treated achieved complete resolution of subretinal fluid. That is, in cases it was 76%, while in control it was 23%. Base corrected visual acuity also improved significantly, 2 to 3 Snellen lines from the baseline in cases, while it was 1 to 2 lines improvement in the observed cases. This was not significant. And the similar studies which were reported, these are Vedavi et al., Gerald Levy et al., and Agrawal et al. Conclusion, topical dorzolamide 2% results in a significant improvement of base corrected visual acuity and more rapid reduction of mean central macular thickness at 3 months post-treatment in treated cases compared to observed. It suggests topical dorzolamide may be a viable adjunctive treatment option for patients with chronic CSR. It can be used as an effective, affordable, and safe adjunctive therapy for treatment of chronic CSR. Thank you.
Thank you. Your exclusion criteria is 1 month of dorzolamide if they do not show improvement.
If they not improve, if the reduction of CMT is less than 10% from the baseline, the
Okay.
patient was included and moved on to the current treatment like focal therapy or photodynamic therapy.
Okay. Okay. Okay.